Hello again, everyone. My name is Marty Guthmiller, and I am CEO at Orange City Area Health System. On September 28th, bringing you the 59th edition of our COVID-19 community briefings. It is Monday, at least the last time I checked. And so as of Monday, we do have a local scoreboard, and I wanted to bring those numbers to you first today. And across the board today, we have high numbers. We're clearly in community spread at this point, and I'm going to walk through these numbers with you and what that all means and where we find ourselves today. We have 431 positives currently through the Orange City Area Health System. We have 24 tests pending. That's out of 3,403 tests. So those numbers keep going up in terms of the number of tests and unfortunately the number of positives. We have a 12.67% positive rate. Comparatively, those numbers were 11.3%, 9.6%, and 8.6% respectively in previous reports. So again, no question. Percentages are going up. In terms of Sioux County, we have 1,669 positives of the 7,710 tested, and that's a 21.6% positive rate. That is 131 additional positives since Friday. The 21.6% in previous times we reported was 21.2, and the time before that 19.8. So both of these numbers are going up as well. I think it's important to point out again that my source of data comes from coronavirus.iowa.gov, and so that you're free to follow up or follow along with these numbers and these stats even when we don't have a briefing. The next item that we've been paying a lot of attention to is the 14-day positive average. And that's where we've been leading the state over the last few days, and a positivity rate exceeding 30% at times. Sioux County remains number one in the state at a 29.6% positivity rate as of Monday morning when I reviewed the data. The previous number that we had was 31.2, so that is a positive move, at least in the right direction, but it is still a very high number and is still number one in the state. Number two in the state is in Northwest Iowa County, also in Lyon County, 26% positive rate. That number was 27.5, so again, coming down, but still very high. Number four, Osceola County, 24.4%, was 27.3%. So still way too high and still a very high number. Number six in the state in Northwest Iowa County at 18% is Plymouth County. And I don't have the number, what Plymouth County was the last Friday. But it is at 18% now. So we have 4 Northwest Iowa counties in the top 6 in the state. So this is definitely a prevalent today in Northwest Iowa. As I've been also reporting, we have 31 counties now in the state of Iowa that have a 10% or higher positivity rate. That number was 35. So if you look at this, things are moving in the right direction. Our percentages are going down a little bit, still too high. And from 35 to 31 counties above 10%, not the numbers that we want, but at least they seem to be preliminarily heading in the right direction. Region 3, hospitalizations, significantly higher. Region 3, again, is the 20 counties in Northwest Iowa. The number of hospitalizations in those counties currently is 96. The numbers previously that we reported was 78 and 63, so they're up 18 from the last time we spoke. We have 22 folks in the ICU in that 20 county area. That number was 15 on Friday. We've had 15 admits in the last 24 hours. An important aspect all along with this is what's your capacity? And even with these higher numbers, the capacity in Region 3, again, this is all Iowa based, in Region 3 is significant. We have a lot of availability. We have 84 ICU beds available in Region 3. We have 443 med-surg beds available in Region 3. And we have 64 ventilators available in Region 3. So with all the information I'm giving, it needs to be understood with that backdrop, that there's a lot of capacity within the health systems collectively to deal with this current surge. The state of Iowa has 86,918 positives of the 786,433 tested. That is an 11.1% rate. Previously, it was 11.0%. Hospitalizations. These numbers on the coronavirus.iowa.gov website typically lag a little bit. So when you look at the hospitalizations that are recorded as of today, it actually has a date of September 26th. I think it was 2:34 in the afternoon on September 26th. So that's the most accurate data that I have at this point, because it does lag a little bit on this website. Number of hospitalizations are higher in the state of Iowa. 315 were reported on the website as of this morning. That number was 276 the last time we spoke. So that's up 39 or so since Friday. Sioux County, a big jump. And we knew this. We knew that in our conversations between hospitals and hospital CEOs, we knew this number was going to be higher. It is at 21 today. That number was at 9 when we spoke on Friday. In Orange City, we currently have 6 COVID patients in-house, and we'll talk a little bit more about that as we go into today's briefing. So 21 in Sioux County. O'Brien County, 5. Plymouth County, 5. Lyon County, 1. Woodbury County, 23. That is up from 16 as well. Polk County is 34, and that is up from 26. We're going to talk a little bit more about hospitalizations in just a second. I want to complete our stats review though, and we'll talk about the deaths. There are 1,317 COVID-related deaths officially in the state of Iowa. That is up 14 from Friday. Sioux County remains at 3. That has not changed. The 14-day trend down continues. And so that, as a measure of the ultimate acuity of this thing, is a good thing, in that our acuity level, as measured by the number of deaths, is continuing to go down, and basically has for the month of September now. I mentioned that we're in community spread. And I'd mentioned also earlier that community spread means that it's not necessarily, this virus isn't emanating from a single source. A state epidemiologist has verified that, the state has looked at that, and it is just community spread at this point. As such, we're asking all of our communities in the county to mask up and practice all the measures that are available, all the things that we've been so accustomed to over the summer. Mask up when you're out in public, hand hygiene, social distance, all those kinds of things. Avoid large groups. all those kinds of things we're really asking our communities to do. We had a meeting last Friday morning with all of our school districts and educators in the county, basically encouraging the same action in that community, and providing them with real-time data, real-time information that is literally changing by the day or half day even. I also want to talk about some specific information that's been out there that is easy to get misconstrued. And that is that the transfer availability to Sioux Falls and Sioux City hospitals has been restricted. It is more limited than it has been in the past. That does not mean that transfers still aren't available. We've been assured by Sanford particularly, and St. Luke's as well in our case, that if we are ever in need of services beyond what we can provide here, we will have them provided by those entities. Ventilators, most likely, high flow oxygen as an example. If we need those services, they are available to us. When we don't need those services, those hospitals are asking us to keep patients here. And again, we're very comfortable with that. We have advanced our therapeutics to include remdesivir, convalescent plasma, those kinds of treatments, and we are doing those locally here. We also implemented a number of negative pressure rooms in our hospital, which is something kind of beyond what some might have or call for. We're doing those. We have the ability right now to have at least 11 negative pressure rooms with COVID patients in if we need them. And as long as we're within the parameters of our abilities to care for folks, again, not needing high flow oxygen, not needing ventilators, we're very comfortable in that environment. Our nurses, our doctors are doing a great job right now in managing those patients. And so there need not be any need for panic. And there should not be a concern about not being able to transfer to a larger facility should that care be needed. That is there. Some of the media might try to convince you otherwise, but that is not the situation. And so we want to assure people that we're comfortable where we're at, have always been comfortable where we're at, and wanted to make sure you understand that very clearly. Some other things that are out there, and you know, a lot of people want tests, and I said, please don't come to our ER at 1:30 in the morning without any symptoms and wanting a rapid test, because you're not going to get one. Our rapid tests are pretty limited. We need to save them for critical times, healthcare workers, essential workers, that kind of thing, when we really need to know rapidly. If you're asymptomatic, you're not going to get a rapid test. The good news for asymptomatic patients, though, is our Test Iowa site. And if you go to testiowa.com, you can you got to go through some questions, follow the prompts, and you'll end up with a QR code. That QR code, you bring cell phone, download it to your cell, complete those questions ahead of time. You can come into our walk-in Test Iowa clinic from 7 to 9 a.m. Monday through Friday, and get your test. It's a Test Iowa site. There's no cost for that. You got to have that QR code. If you don't, we'll have the ability to help you here, but we really ask you to do that ahead of time, make things go a little faster. Monday through Friday, 7 a.m. to 9 a.m., walk-in clinic for Test Iowa. Anybody can get tested, whether you're asymptomatic or not. If you're symptomatic, we really still prefer that you go to the clinic, that you're seen by a provider. But if you're asymptomatic, you're not having symptoms, but you want to get tested, you're just a little bit concerned, come get tested. That's available for you. Also, flu clinics. Getting your flu shot is really, really important, even more so than it's been in the past. Our next flu clinic is tomorrow night, Tuesday night, here at the health system. more than ever, we're encouraging you to get your flu shot 5:30 to 7:30 p.m. tomorrow night. We have the flu clinic here in our regular clinic. We ask that you mask and do your paperwork ahead of time. That's available on our website. And while we are asking you to socially distance while you're in line, we realize that some of that might be outside tomorrow night. So if it's a little cool, please dress accordingly, because you might be waiting in line outdoors. That's a lot of information for today. I hope that helps a little bit. I really ask you to continue to practice those measures that we've discussed for a long time now. We're comfortable where we're at in terms of our ability to care for people. We will care for you. Come on in, and if needed, and we will take care of you. And if you need transfer care, that is available should you need it. And we want you to be comfortable with that as well. This week's schedule, I've been doing Thursday or Fridays, and most likely this week it's going to be Friday. And so I will anticipate a Friday morning briefing, kind of see how the week goes. I do not anticipate being available on Thursday, but if something comes up prior to that, we'll be sure to let you know as soon as we find out and can deliver that message. Thank you for joining us today. As always, we ask you to stay strong through all of this, stay vigilant, and stay healthy. Thank you for joining us again.